Duke University says about a quarter of COVID-19 cases on campus were found as a result of contact tracers. The university using information coming from those workers to implement more safety procedures. CBS 17 digital reporter Judith Ratana is digging deeper into the state's contact tracing program.
Without a vaccine right now, contact tracing is one of the really big ways that we can help prevent spread.
Contact tracers at Duke were able to link some of their cases to campus dining halls. They've now chained down chairs to keep students distance and have people walking around reminding diners to put their mask back on after eating.
Surveillance testing, our social media campaigns, behaviors of our students, all of those things have been really, I think, combining together to help keep our cases low.
150 trained contact tracers work solely with the school. Their familiarity with the campus helping build trust with students to be more forthcoming.
Our desire to know that information and to know that accurate information is more important than punishing a student around that and maybe perhaps not getting that information.
It's a different story at the state level. A study from the CDC shows between a third and half of patients in North Carolina claim they had absolutely no contacts to trace. Of those who did, a quarter to half could not be reached by contact tracers. And the state's number of 1,500 contact tracers is down by 500 from earlier in the year, even as new daily cases continue to rise.
The state did not respond to my question about the potential need for more contact tracers, but the story continues online with a group who says the state is not meeting its needs. How we stack up against the rest of the country online at CBS17.com. I'm digital reporter Judith Ratana, CBS 17 News.